I do think that my advice would be that you're focusing AI to direct improvement in not only in the patient care or the reduction in cost, which is also important in the modern healthcare, but also the patient experience and the physician experience, the provider experience.
Artificial intelligence is rewriting the surgical oncology story, not with cold calculations, but with clarity, connection, and compassion. From helping surgeons see what the human eye can't, to personalizing treatments with unprecedented precision, AI is making it possible to act earlier, operate smarter, and care deeper. At its best, AI doesn't replace the hands of a surgeon or the heart of a healthcare provider. It extends them. It empowers care teams to operate with greater precision and to preserve what matters the most: the dignity and humanity of every patient journey. In this episode, we're honored to sit down with Dr. Michael Choti, Chief of Surgery at Banner MD Anderson Cancer Center, a renowned leader in surgical oncology. Dr. Choti brings a decade of experience in hepatobiliary and pancreatic surgery, surgical innovation, and academic leadership. His work is reshaping the way that we approach complex cancer care. Dr. Choti is joined by Cherry Calalang, Head of Clinical Excellence at Azra AI, to gain insights into how artificial intelligence is transforming the field of surgical oncology. Without further ado, here is our conversation with Dr. Michael Choti on the Innovate Oncology podcast, presented by Azra AI.
Hi, Dr. Choti. I'm going to go ahead and just kick this off. You have been a leader in surgical innovation, so I'd love to just start with a big picture question. Essentially, how has AI reshaped the way you plan for or perform cancer surgeries today?
Yes, thank you for having me. Yeah, it is a transforming time right now. Unfortunately, cancer and cancer surgery, but just cancer in general, the incidence is going up. We don't understand why, particularly in young patients. So it's becoming an increasing problem. But a variety of areas of technological advances, including AI, have hopefully brought in a level of optimism. I mean, molecular genetics, personalized medicine, a variety of areas are bringing in a level of optimism for improving cancer care, improving patients' outcomes, and their experience with cancer surgery. AI is one example. Artificial intelligence is one example of that. With regard to the specifics of your question, how it affects cancer surgery, I would say it's kind of in a variety of different categories. One is the preoperative, that is the determination of whether surgery is indicated, things that are regarding the biology of the cancer, the information management, that AI will help facilitate the ability to identify which patients may derive benefit from surgery. On the back end, of course, the monitoring, the surveillance, the postoperative care. But as you implied, even the surgical procedural way that AI can facilitate. Currently, I would say it's not fully ready for prime time, but I think there are future opportunities for how AI can improve. But currently, modern technology of surgical techniques involve the procedural, even the robotics space, robotic surgery. Doesn't really use formal AI, but use, of course, advanced technology, imaging to help support performing operations. But I think in the future is where increasing use of information and artificial intelligence to help facilitate performing operations more safely and more efficiently, both to help the patient and help the surgeon and staff to do it, to perform these procedures well. So it's really, I would say AI in the whole cancer and cancer surgery journey for the patient and for the cancer team. I think there are opportunities for AI currently and perhaps more in the future to transform how we care for patients.
I would like to zoom in a little bit because you had mentioned a little bit about image guided and robotic assisted. But when it comes to this technology in action, what have you seen like the most promising ways to apply image guidance and robotic assisted AI in surgical oncology today?
Yeah, so we're already using, one technique is using a variety of robotic surgical techniques to perform operations more minimally invasively. And currently, yes, there's improved imaging and facilitating the ability to perform procedures. In the future, there'll be opportunities to perhaps automate components of the operation or to facilitate imaging or to image register. A new technique we're using now where we can destroy tumors using, rather than cutting them out, to use robotic systems to use ultrasound or radiation therapy or other ways to destroy tumors. And now AI can be used, for example, for image fusion to take the preoperative imaging, the scan of the liver, MRI scan, for example, and fuse those images with, let's say, ultrasound guidance, for example, to more precisely destroy cancer. There are ways to, for example, using uh, new agents and markers and combining them with imaging to identify the margins of cancer so we can more precisely remove a cancer without destroying normal tissue around it. So a lot of opportunities to marry the new robotic technologies we have with the information, preoperative information and intraoperative information to improve the ability to actually perform the procedure. I would say the other area that I think could be very advantageous and is just emerging now is the use of AI to teach robotic techniques. So could improve the learning curve on young surgeons that are developing the technique by monitoring motion, more efficiency of motion, and so forth. So that learning curve, if you will, could be reduced by using new training techniques, applying artificial intelligence. So a variety of areas where I think it can improve the actual cancer surgery.
Yeah, that sounds like really good steps forward towards precision and performance with the use of AI. Beyond the operating room, I know that the AI doesn't necessarily stop once the procedure's over. How do you see AI contributing to post-operative care or improving long-term surgical outcomes for cancer patients?
Yeah, I think it's a good question. I think that is an area where we're really going to see a significant improvement because the whole cancer surgery is not just the procedure itself, but the surgical oncologist is we are oncologists that are treating cancer patients. We don't use chemotherapy or radiation, we use surgery, but we're oncologists that determine appropriate indications for applying that cancer technique. And same thing on the postoperative side, the monitoring and surveillance. But with regard to the application of AI postoperatively, one important area is the determining the precise prognosis, because of course, when cancer surgery is done, then determining the pathologic analysis of the cancer, the staging, the nature of under pathologic review of the cancer, of the lymph nodes, of the margins, all of these things that by using more sophisticated artificial intelligence for, let's say, molecular testing of the tumor or determination of the margins or assessment of any spread can then determine postoperatively what the patient's prognosis is, what's their risk of recurrence after successful, let's say, removal of a cancer, whether additional chemotherapy after surgery may be recommended based on. Right now, we use standard systems of standard algorithms where if the prognosis after cancer surgery, the risk of recurrence is high, then we may, let's say, give postoperative adjuvant, we call it adjuvant chemotherapy, for example, or sometimes radiation therapy in a preventative mode in a patient where the risk of the cancer recurring may be higher than other situations. The implementation of AI technologies in a more sophisticated way to determine the prognosis, the risk of recurrence will be hugely important because right now we may, for example, give chemotherapy to many patients who postoperatively who may derive a benefit from treatment, but many of those patients may be cured with surgery alone. So we use relatively crude metrics, crude factors that we base the recommendations on whether to take postoperative chemotherapy, adjuvant chemotherapy or not, based on this tumor size and the tumor lymph nodes and some basic maybe that use more sophisticated informatics to determine prognosis can then select patients that are maybe derive more benefit or may not need postoperative chemotherapy. By the way, similarly on that same line, something that's important that is often not considered is the design of clinical trials to determine a benefit. Right now, our methodology of how we determine clinical trials is relatively, I don't want to say crude, but we may do randomized trials on hundreds or thousands of patients to determine whether there may be a benefit of a given therapy or not, whether it's surgery or chemotherapy or whatnot. I do think that the implementation of more sophisticated clinical trial design using artificial intelligence to be able to more personalize individuals to determine what, so even the clinical trial design could be in a way where we don't have to do a randomized trial with thousands of patients to find and years before we have an answer and hundreds of thousands of dollars or more to run the clinical trial, where we may be able to determine the effectiveness of a given drug or whether surgery or not based on a smaller number of patients because we have a more refined clinical trial design using AI. So I think that's another area where it can impact, whether it's in the postoperative setting or in cancer care in general. The other areas on the postoperative question that you ask are even in the immediate postoperative care. Obviously, when cancer surgery is done, there's always a risk of a complication, infection or other. And so there may be that I do think, while not currently being used, I think the implementation of AI to help predict or a risk of a complication, for example, can prevent potentially complications um, or identify them earlier. We say so-called rescue. That is, if one is developing a complication, if we can use informatics, other systems of artificial intelligence to identify a patient who is developing a complication after cancer surgery earlier and then intervene, then the probability of salvaging or rescuing from that complication is greater. So I would say in the postoperative short term to monitor uh, and determine whether an adverse event may be occurring, we can intervene earlier. And then the other area on the postoperative management is in the monitoring, the telemonitoring, if you will, of patients using this technology to determine once a patient, while in the hospital or at home, is developing a problem or a complication. So a variety of techniques for post-discharge telemonitoring is another exciting area where we can improve patients' outcomes after complex cancer surgery.
If you're enjoying this episode of the Innovate Oncology podcast, subscribe to the show on your preferred streaming platform so that you're notified when new episodes are released.
Do you have, or can you share a specific example of when AI helped to reduce some of the complexities and improve outcomes in any particular challenging cases that you have experienced?
Well, there are a variety. I would say this AI is being introduced slowly, but one area we're applying it now, I mentioned there's a new technology that we're applying here at Banner MD Anderson to destroy cancer tumors currently in the liver using ultrasound cavitation. The technique is called histotripsy. It's a robotic system non-invasively to destroy tumors in the liver. One way we're using this technology is image fusion, where we can, as I mentioned, take the preoperative imaging, the MRI scan, for example, and fuse that with the real-time ultrasound imaging of the tumor to more precisely target a tumor that may not be, let's say, as visible on ultrasound, but by registering the preoperative imaging, we can more precisely destroy the tumor with clear margins and not destroy surrounding healthy tissue. So that's one application where I think we're using kind of this image registration to more precisely target tumors for destruction.
So, for many health systems, implementing AI isn't always as simple as just like flipping on a switch. How do you feel, and what do you think of, biggest challenges are that hospitals are facing in adopting AI-based platforms at scale?
I think one very important thing is I don't think there are a lot of barriers actually to applying it in health systems. I do think that there's going to be some real advantages both for the patient, many of the things we talked about, but also for the provider, the surgeon, the oncologist, because right now with documentation and with the looking at reams and reams of medical information, medical data can sometimes be difficult to glean. Using AI technologies to more in a more sophisticated way to understand the important information allows more time for the clinician, for the surgeon to spend time with the patient and less time facing the computer and so forth. So I think that will be a big advantage. And I think that's the direction, even as health systems are challenged now. I do think that my advice would be that you're focusing AI to direct improvement in not only in the patient care or the reduction in cost, which is also important in the modern healthcare, but also the patient experience and the physician experience, the provider experience, so that that's very important so that the patient derives a benefit, the physician-patient relationship is improved, not hindered by application. I'm optimistic that these technologies, even what we're starting to use now in the clinic, rather than, as I say, to use AI technologies to filter intake of information to be able to better make recommendations for a patient. And then we even are using technologies in the clinic now with kind of ambient listening systems where rather than having to be typing and patients seeing our back all the time with as we can have a normal natural language conversation with a patient, and AI technologies will then document and determine what's important and appropriate in the medical record. So these are all areas that I think health systems will value. I think probably one concern, of course, is will this drive cost up? And that health systems always see that as a barrier. Right now, delivering healthcare is just so expensive now that we have to do things to find ways to drive costs down. We don't want to add new things like new AI technology that add cost, but in fact, the opposite. Find ways that this technology, these advancements will reduce cost and reduce burden, as well as improving patient outcomes. So I think there are less barriers, I would say, to the implementation, provided it's done well. And again, which industries are coming into the market and how it's implemented could be barriers, but I think that that modern health systems will recognize the value and I hope implement it. I know Banner Health is really leaning into a variety of areas of AI, both whether it's on the finance side or the academic side, but also on the patient care side to improve both the patient experience outcomes. But also what I really like is that the emphasis on improving the provider experience so that we can focus on, as a physician, as a surgeon, why we went into medicine, not to be worrying about the finance and documentation, but more focusing on delivering care to the patient. And I think that many organizations like ours realize the value of this in the physician or the provider experience.
Okay. Now, looking ahead, what breakthroughs are you most excited about in the next few years?
Well, in a variety of areas, you can see this is a very exciting area. Even I think in the technique of cancer surgery, I do think this is an exciting area. I mentioned that we're starting to use AI in the actual performing procedures, but currently I would say that's not fully implemented. That's an exciting area where I think that uh, improving surgical technique through enhanced precision, reducing error, improving it, teaching how we do these procedures. I think that's going to be really exciting. I'm really looking forward to that. So our new generation is going to really be able to implement very innovative techniques where AI could be used to even automation, surgical automation could be an interesting area. And I do think that another area that I think will be important, I don't know about necessarily exciting, but important is this focus on value, because I do think we need to, healthcare in general has to really focus on maximizing quality, and minimizing healthcare costs. And I think that I'm excited to see the implementation of AI technology to work on that value proposition.
Perfect. Well, Dr. Choti, thank you so much for sharing your insights and experiences and really the vision for the future of surgical oncology and AI. It's clear that AI isn't just a tool, but it really is becoming an integral part of how we plan and perform and really personalize care for our patients. So I appreciate your time today. Thank you.
My pleasure. Thank you.
From precision-guided robotic systems to post-operative insights driven by data, our conversation with Dr. Choti illustrated how artificial intelligence is no longer a distant concept in medicine. It's here, it's evolving, and it's already making an impact across the full spectrum of cancer care. And as Dr. Choti shared, we're not just using AI to enhance what happens in the operating room, we're using it to guide better decision-making, improve patient selection, personalize treatments, and even rethink the way that we train the next generation of surgeons. At Azra AI, we believe that artificial intelligence should never replace the human touch, but rather it should elevate it. That means giving clinicians more time with patients, easing administrative burdens, and enabling care that's more precise, more personalized, and more compassionate. Thank you to Dr. Choti for sharing your insight, expertise, and vision for the future. And thank you to our listeners for joining us for this conversation. Until next time, stay curious, stay compassionate, and keep innovating. Thanks so much for listening to the Innovate Oncology podcast presented by Azra AI. If you'd like to learn more about the matters discussed in this episode, check out the description below for more information. Join in on the conversation when you follow Azra AI on LinkedIn or visit our website, azra-ai.com.